Can I ask, who do I have here with me today?
So I'm Josh Filmore, Health Markets, licensed insurance agent here. We do health for individuals and families and Medicare.
Health insurance. Josh, fantastic. Well, where are you originally from, if you don't mind me asking?
So I am originally from here. So I am a true Florida-born Lakelander. I know I'm like a unicorn. We're few and far between these days. So
That's right. And my wife's a Floridian, but she's a Plant City girl.
okay, all right.
And,
We won't hold that against her.
And you're a family man?
I am. Yeah, I'm married to a beautiful wife, Erica, and then I've got three wonderful babies. They're not really babies; they're actually getting grown now. My oldest is Emma Grace. She's going to be 13 in November, so I have a teenager on the house.
Wow, welcome.
Yeah, crazy to think about. My son will be 10 in about a month. That's Wyatt Jackson, and then the caboose baby is Addie Rose, and she will be 6 tomorrow. No, Saturday.
Addie Rose.
Addie Rose. Yeah.
How'd you come up with that name?
It was kind of a mix of two names that we really, really liked. Addie, of course, was the first name that we chose, but we were trying to decide who was going to be named Rose. So we just mashed those two together. It worked out great. So, yeah.
That sounds beautiful. Yeah, I grew up just loving the name Jennifer.
Mhm.
Just Jennifer. I said, one day I have a kid. If I have a girl, I want to and boy came through.
There you
Jennifer
go.
Elizabeth.
That's awesome. Yeah, me and my wife had that same thing. We first got married. We waited 5 years before we had kids, but it was always that a daughter was going to be named Emma. So we loved the name Emma. So of course, when Emma showed up, it was done. There was no thinking about it. It was just, that's her name. Yeah.
Like to put set up in stone ahead of time. I knew it was going to happen, and it happened.
That's right. That's right.
So health markets. I recognize the logo.
Yeah.
Because I don't know when it was. It's been 4 or 5 years ago. I guess it was probably when I retired in 2017. I started hunting for health insurance. And there's one over here on Lakeland Hills Boulevard. We went over there. Tell me more about what Health Markets is and what it is you do, if you don't mind.
Okay, so that office is our office. We have a shared office, so that's the one I work out of.
Okay.
But yeah, Health Markets is just basically a brokerage of independent agents. So we're an independent agent. We represent multiple different companies. So pretty much if you need insurance, we can actually pretty much write it. So there's not really a carrier that we don't cover. We're also licensed out of state. So I'm licensed in probably about 10 different states. So we can actually write insurance outside of the state of Florida. I've got several clients in Georgia and Ohio and Michigan. So we just basically take care of everything that you need when it comes to health insurance to make sure you're covered medically, but we also want to make sure that you're protected with your wallet as well too. So we go through a pretty rigorous interview, fact-finding type of setup when we first meet to find out what your needs are so that your needs are met, to your unique family.
I think I remember going online and filling out some questionnaires and all that, get prepared or whatever, and doing all that. And so it goes from private to government to you offer all of the different insurance agencies, agent companies that are out there.
We do, yeah. So we even represent small groups. So if there's business owners that need group insurance for their employees, we actually represent that as well too. So think of the insurance agent as kind of the middle guy, right? You have questions, you need help, and we're going to try to find the best company that would fit those needs for you. So we're the broker. We're the ones that are in the middle, making sure that we're doing everything that makes sense for you, not the insurance company.
Yeah, I can imagine every single person who walks in the door is completely different. Their needs, their wants are completely different. Some are for small business, some are for families and whatever. And even my dad and my in-laws, they're over 65. How about them?
So that would fall in the Medicare category, and we actually represent Medicare clients as well too. So yeah, we can definitely take care of anybody over the age of 65. So two different brackets. We call it under 65, over 65. That's kind of the teeter point for us, and that's how we decide which program works for what client. And then in the over 65. Insurance gets really confusing at that point. There's a lot of options. There's a lot of different programs. There's a lot of different ways that you may get insurance covered. And there's a lot of different nuances when it comes to Medicare. And sometimes, unfortunately, they pick the wrong plan and it usually ends up being bad in the long run.
Costing more money.
Yeah.
Yeah, you want to maximize the services available at the minimum cost.
That's right. Yeah, and that's our goal is to be able to do that. For instance, Medicare, we'll bring it back to that for a second. A lot of people, they get the red, white, and blue card and they're like, yes, I got Medicare. But what a lot of times agents don't tell them, if they even get the opportunity to even speak to an agent, that they have to have a prescription drug plan. So there's a lot of people out there that have a penalty over the top of their head because they didn't get their prescription drug plan in time for requirements of Medicare. So that's one nuance. The other nuance is that yes, I'm on Medicare, but what they don't understand is they're also on the hook for 20% of whatever bill that they incur. So whether that bill is $100 or that bill is $100,000, they're responsible for 20%. So like my dad who had open heart surgery, that bill is $390,000. Could you imagine 20% of $390,000? So there's a lot of people that have Medicare, they have insurance, but they can't afford the co-insurance that comes inside. And that's where we step in. We step in to be able to show how to be able to bridge that gap so that you're not staring at a $60,000 co-insurance bill of 20%, right? And we show ways to be able to cap that or even have that paid for all in total. So
That's fantastic because, yeah, my dad, he's had a couple of heart attacks, a couple of heart operations, and I don't remember him ever saying, you know, how much he's got to pay or anything like that. I never paid attention.
yeah. And that's the unfortunate thing. Most people don't pay attention, right? And that's where usually you get caught up with, well, I didn't know, or why is this so expensive? It's because you, A, didn't ask the right questions the first time whenever you got ready to get set up with insurance, and B, you didn't pay attention. I don't know how many times I've called or talked to a client that's looking to change their plan because it's too expensive. And I ask the question, well, what company are you with? And they can't tell me. That's a problem, right? Why would you sign up for something that you don't know how it works? And so that's our job as brokers is to make sure that not only we get you in the best plan that's suited for you and your family, but to also educate you so that you know what that plan actually entails.
Yeah, because paying a premium, everybody knows how to write a check if you got it. But the details, having someone who can answer the questions, if I got a prescription problem, if I have a billing problem. So having what makes, I mean, let me just go ahead and say it.
Yeah.
I know, it's no secret, that agencies have competition and you have to provide a service, you have to provide customer service, whatever you're thinking. Is there something that makes you stand out that
Yeah, there's actually a couple of things that really stand out, specifically for me. Now, I can't talk for every other broker out there, right? I can only tell you what my experience is like and where I try to fit in to help out the community, right? And so the biggest aspect is making sure that when we meet the first time, I understand your situation, right? I want to know the ins and outs on why we need to make a change or why you're looking for the coverage to begin with, right? So that way we can understand how to help. That's the first part. And we dive in pretty deep to make sure that we're trying to uncover every rock to make sure there's no gaps in your coverage. Because the one thing I don't want to hear is, oh man, I wish you'd have told me about this policy because now I'm in this predicament, right? There's been times where, I've tried to talk to people about life insurance and they, decided that they couldn't afford it or it wasn't important, right? And now we're having to explain to their wife that they didn't think it was important at that point in time. So those are tough conversations. So we try to avoid those types of conversations right off the bat. And second, what we do is a lot of times, whenever you sign up for insurance, especially over the phone, you don't really know where that agent is. And I've had multiple clients say, yeah, I have an agent. I don't know where he is or who he's with. And come to find out it's some company out of New York. Right. Well, that's where we stand out separate. I'm here locally. So I'm here to help you locally with your problems. So like you just said, if I have a problem with prescriptions, I don't want to have to call a 1-800 number, right?
That's
I want to
right.
be able to pick up a phone, call the local agent who's here that can help. There's been many times I've actually made house calls where, there was a shut-in, a lady that that couldn't get out of the house because of her medical condition. So we'll go there, right?
Absolutely.
Our goal is to make sure that we stand out over and above with customer service in the times when you need it, right? Because there's this county, this city, this entire country is full of agents that are great about taking your money and sending you down the road.
I hope they don't call me back.
That's right, exactly. A number in the system, right? And you hope that that it's a one and done, and you never talk to them again.
Yeah.
Our goal is to make sure that we have several different touch points throughout the year to make sure that hey, Don, something changed. Did your daughter get married? Is she coming off your insurance now? Does she need insurance? Oh, wow, you got a grandbaby on the way. How's that grandbaby, going to be insured? Those are the types of things. You moved, right? A lot of people don't know that when you move, there's a pretty good chance you might need to change your insurance, especially when it comes to Medicare.
Are you
So if you move outside of the service area, you are supposed to change your Medicare insurance.
Even though that's federal?
Yeah, well,
That's weird.
well, Medicare is actually state. So each
Oh.
state has its own regulations. So, but what happens is you move out of the area and that plan's not offered in your area anymore. So there's some times where you may have to call and change your plan because you changed counties. So there's a lot of nuances, but going back to why we're different, that's a quick phone call to say, hey, I moved. Is there something that we need to worry about, right? Or hey, I slipped and fell, right, this weekend and I ended up in the hospital. I remember you telling me about an accident plan that may put money back in my pocket because I had an accident. So those are the types of ways where we stand out.
That's fantastic. And you keep up on the latest information that's available to anybody and everybody.
That's correct. Yeah, because there's annual enrollment, open enrollment, especially for Medicare, but there's also annual enrollment for under 65. So as plans change, right, we are to make sure that our job is to stay on top of those plan changes so that we can talk to our clients and say, hey, Don, that plan that we put you on last year is not going to be so great this year. We may need to take a look at making a change on that aspect. So our goal is to serve you guys, right? Our goal is to serve the community and making sure that the community is covered medically. But again, we have one step further that we take, and we also want to make sure we protect your wallet as well too, so that you're not getting stuck with a huge deductible or huge max out of pocket that you can't, afford.
Yeah.
Worst case scenario is you're in the hospital and you're like, how am I going to come up with $10,000 to pay this max out of pocket? And so that's the last thing you should be worried about at that point in time. So that's where we want to make sure that we step in and bridge that gap ahead of time.
Yeah. What about, like, I'm just thinking of special situations, like someone who has a health insurance and then all of a sudden they become pregnant. There's plans for that?
Yeah, so if they're on group insurance with their job, they didn't have to worry about that. That'll be covered on that aspect. It's when you're not in group insurance, like you're an employer, is where we step in. And there are plans that will accept, and there are plans that won't. So there's plans that'll say no, that's a pre-existing condition, which is kind of stupid, but there are plans that'll deny a pregnancy. So we'd have to go and find a different plan. But yes, I've gone through that 3 times already this year. So having changed plans because somebody got pregnant.
Yeah, my wife worked for Watson Clinic here for 13 years, and I know hearing the plans, the network of this, selecting this, it's just beyond my comprehension. Thank goodness I wasn't the one that had to pay attention to it because it is detailed and very, very detailed. And so you guys take the time, you listen to the customer, provide above expected service locally here in Lakeland.
Yep.
And you're from a local guy.
Local as you can get. There is no other more local Lakelander than me. Born in Lakeland Regional, grew up here, went to church 40 years, here to church right downtown. And I went to Auburndale High School, so don't believe on me on that. That's where my dad lived. But my dad was, a city employee for 40-something years.
Oh, wow.
When he retired from Parks and Rec. So I've got to see as many Detroit Tiger games as I could shake a stick at. Got to meet most of the players,
wow.
Got to sit in the dugout a couple of times, so it was really cool here in spring training. But yeah, my dad was a Parks and Rec guy all the way from the beginning. So.
And how long have you been in doing this?
So I've been licensed since 2008.
Okay.
I've actually done quite a few different types of insurance jobs. I was a stockbroker for Merrill Lynch for quite some time. And then decided I didn't want to do that anymore, and then kind of went back to what I know. So,
I'm just not a follow the paperwork and do all that. My wife does all. I'm so very fortunate. I just know that there's a lot involved.
Yeah, and I'm not either. That's why I have an assistant. So
there you go. So. Anyone who sees this and wants to get in contact with you, how's the best way to get in contact with you?
So usually just call me. That's usually it's a call or text. Either one works pretty well. It's 863-528-4663. That's probably the best way to get a hold of me. That's my cell phone number, so please don't sell it to any marketing companies. The other way is you can go to my website. Probably the easiest website to go to is Filmore, which is my last name, Fil, only one L. I'll get to that in a minute. But More Group LLC.com, and that'll take you to our insurance page where they can fill out information and go right straight to the inbox.
Fantastic. Is there any recommendations at a time period? I think October, isn't October? Seems like October pops in my head when you go in and fill out.
Yeah, so anybody under the age of 65, November is when that starts.
November,
Yeah,
okay.
it usually starts November 1st, goes all the way to January. Most times, January 15th is kind of cut off. But then open enrollment or annual enrollment rather for Medicare starts October 15th. That's where you get to see all those commercials and everything gets dumped in the mail and all that fun stuff. That starts October 15th and goes all the way to December 7th. But that doesn't necessarily mean that you have to only be sign up in that point in time. If you have questions or have problems with the insurance, you can call me anytime throughout the year. We usually have a special enrollment going sometime that we can usually get people in and out of plans mid-year. So best way is just call and ask the question, right? And ask the right questions. That's one of the key things.
So now that you've been here your whole life, I mean, I wish I could say that, but I can't. Do you do anything in the community?
Yeah, so again, I've been here 43 years, 43 years old, born and raised. So I've done a lot here in the community. But one of the coolest things is we're part of the Southern Baptist Association. We go to Faith Baptist Church, which is over here off of 33. But just recently, not this February, actually, February of last year, 2024, my wife and I got commissioned as local missionaries. So we're missionaries for family and marriage ministry. So we've been doing that with Family Life. That's a Cru organization. Cru is a part of a Campus Crusade for Christ, is what it is. But Family Life is their family and marriage ministry offset. So we're local missionaries and trying to raise some financial support for that right now. So it's been kind of
you over the 40 years, you said to yourself, one of these days I'm going to become a missionary, or
no,
how did it happen?
nothing, anything like that. So it was kind of one of those God, you're calling me to do what? Kind of an aspect. So I had never had any inclinations on preaching. So funny story, I told God that I'd never do two things, right? It's funny when you're going to tell
you want to make God laugh?
Tell him that you're not going to do something, right? So I told God I'd never preach and I'd never be a missionary. And so here we are, raising support to be missionaries, and I've preached already twice. So it's been an interesting journey that God's got us on. But that's what we're kind of doing outside of.
That's fantastic. That's definitely a community part of the community. That's what. I've told God dozens of times, I'm never going to be a millionaire. I'm never going to be a millionaire. So we'll see what happens. That's fantastic. Well, I appreciate your time, and I had to throw that in there just to see.
Yeah.
You know your stuff.
Yeah.
You know your stuff.
Well, I appreciate
That's
that.
fantastic.
So I did mention one thing I wanted to add. I said I'd come back to the last name.
Okay.
It was only one L. So apparently we are connected to Millard Fillmore, the president, family relations, but because everybody is from the Appalachian Mountains, they apparently got lazy and dropped one of the L's. So that's why we have one L instead of two. So that's kind of a fun history fact there.
I did some research when I retired. I did some family research, and turns out I'm related, cousin, long term, whatever, to the guy the poet Burns, who wrote Old Lang Syne. Why am I forgetting his name? Robert Burns.
Okay, yeah.
Robert Burns out of Scotland. And so through the chain, of course, we're all related at some point. Well, I appreciate your time.
John, thank you very much. I greatly appreciate the opportunity coming on, and we just want to be a resource. We want to be able to help the community as much as we possibly can, and making sure that again they're protected medically, but also protect their wallet on the back end.
And you can find them on IamLakeland.com. And I want to thank Cohas for letting me use this beautiful, beautiful room. Yeah. And if you guys need anything, rent, business offices or public space, Cohas is available.
Cool.
Have a fantastic
day. All right, you too.